Good morning. This is Lisa Grenna with Family Programs Management um, at DLA and MWR. Welcome this morning. Thanks for joining us for managing your health during challenging times. We're so excited to partner with Michigan State University Extension Office. And today we have Holly Tiret and Georgina Perry with us. They are senior extension educators with MSU Extension in social emotional health and health extension research for MSU. So welcome, ladies. And Holly, you can go ahead and take it away.
Great, thank you. And thank you so much for allowing us and inviting us to present to your group. We really do appreciate it. And I will let Georgina introduce herself and then we'll get started.
Hi, everyone. So, yes, I'm Georgina Perry. Like Lisa said, I am a health educator at MSU Extension, and I also am excited to be here and able to join and present to you today. And I recognize a couple of names. I did, gosh, it seems like it was a long time ago, but I'm sure it was only like 2 months ago when we did the mindfulness, Stress Us with Mindfulness series. So, some of you may have attended those sessions. So, I'm glad to be able to be back. Thank you.
So I'm going to start with our affirmative action statement. We read this at the beginning of all of our presentations because we're funded in part by the USDA. It's part of our civil rights compliance, and it's also been a part of our mission for over 100 years. MSU is an affirmative action equal opportunity employer. Michigan State University Extension programs and materials are open to all without regard to race, color, national origin, sex, gender identity, religion, age, height, weight, disability, political beliefs, sexual orientation, marital status, family status, or veteran status. So the objectives of the workshop today are to discuss ways the current pandemic has impacted healthcare providers, systems, and patients. We'll talk about strategies to maintain mental health. We'll talk a bit about grief and loss and finding ways to stay socially healthy. And we'll explain ways for you to maintain your physical health during challenging times. Before we talk about what affects mental health in a negative way, it's important to define what mental health means. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. The past several months have been a whirlwind of emotions as many of us adapt to our new normal during the COVID-19 pandemic. Adapting to change is difficult. Adapting to change during a crisis is even more challenging. Yet adapting to change that seems ongoing is like trying to find your footing in an earthquake. That is how you might describe the roller coaster of feelings, moods, thoughts as time progresses, and researchers are starting to take notice as well. In March 2020, in a letter to the editor of Brain Behavior and Immunity, author Montemurro suggests high levels of stress are affecting frontline workers as well as the majority of people. Mental health professionals are seeing psychological impacts in people who are already dealing with mental health issues and those who have not been previously diagnosed with depression and anxiety. This should be a signal to pay attention to your own mental health as well as monitor the mental health of those around you. There is a rising concern over an increase in post-traumatic stress disorder and for potential suicides. In the United States, the National Suicide Prevention Lifeline has a dedicated page on emotional well-being during the COVID-19 pandemic. On their page, they have downloadable toolkits with recommendations of support, how to support yourself during social distancing, such as being your own advocate by connecting with others, educating yourself, and understanding mental health risks. The first step in dealing with stress is recognizing when you're stressed. Look for symptoms of stress in yourself and those close to you, such as not being able to sleep, sleeping too much, over or under eating, being moody. Another symptom may be hypervigilance, which is an exaggerated intensity of behaviors leading to exhaustion. It's important to do a periodic stress self check-in. This could be weekly, daily, or hourly. Take a moment to pause and think about how you would answer these two questions. What are you currently stressed about, and how is that stress affecting you? Physically, socially, emotionally, mentally? Write down your responses in a journal as a way to keep track of what is triggering your stress and how it is affecting you. If you notice symptoms of stress, take action. You can start by talking about what's stressing you out. Some refer to this as name it to tame it, as described by Dr. Daniel Siegel in his book, The Whole Brain Child. Although we can't change or eliminate stress, research has shown that by intentionally changing our response to our stress cues, we can increase our resiliency or a person's ability to bounce back from adversity. Try bringing more fun into your everyday life. Watch a comedy, reach out to friends and family virtually, go for a walk, or cook a new healthy recipe. Commit to exploring ways to practice mindfulness and meditation online as another healthy way to respond to stress. In an article posted in the Journal of Health Psychology 2020, author Mateus and colleagues suggested that the COVID-19 pandemic has presented a challenge to our own coping mechanisms during the crisis of being able to get back to the balance of basic human needs: physical, emotional, and social. They encourage the benefits of including some physical activity into each day, to whatever extent a person is capable of in their current physical state. People benefit both physically and emotionally from daily exercise, and this helps us to maintain and reset our body and mind to a state of balance. During COVID-19, people are experiencing an overwhelming amount of grief and loss. Normally, friends and family have rituals to recognize and ease pain through funerals, wakes, sympathy cards, casseroles, spending time together. During the outbreak of COVID-19, many of these rituals have been prohibited, which can lead to added challenging feelings of distress. So it's important to recognize the amount of deaths related to COVID-19 as compared to other leading causes. According to the CDC COVID tracker, and I've updated it since this slide, as of today, there are over 293 cases of death due to COVID-19. And when you compare that to the other leading causes of death, such as cancer, accidents, stroke, diabetes, the flu, and suicide, you can see the enormous difference. In 1969, Elizabeth Kubler-Ross wrote a book about the 5 stages of grief. Denial, which is this just can't be happening. Anger, often a cover emotion for intense feelings of grief and loss. This anger can be directed at anyone or anything. The third stage is bargaining, a very real human reaction to a desire to regain control over one's life. Depression, immediate as related to outward details of loss, the funeral, the obituary, the service, and inward as we prepare to lead a separate life from the person we lost. And acceptance, this stage may take a long time, if at all, and no one should be pressed to just move on. Some important things to remember about grief. These 5 stages do not occur in any particular order. Everyone grieves in their own way and in their own time. There's no predictable beginning or ending to the process. Authors Zai and Du in 2020 recently published an article in the Journal of Brain and Behavior and Immunity. In this article, Loss and Grief Amidst COVID-19, A Pathway to Adaptation and Resilience, they recognize that many individuals are experiencing significant losses due to the COVID-19 pandemic. They describe different types of loss and caution that not recognizing and finding ways to cope with stress and loss can lead to disruptions in physical and mental health. The authors discuss 5 types of loss: a primary loss, such as the death of a loved one; a secondary loss, consequences of primary loss, such as companionship, intimacy, or family status; multiple losses, like employment, housing, medical insurance; stigmatized loss, facing shame for contraction and or transmission of COVID-19; and ambiguous loss, which is separation from family and friends. Dr. Pauline Boss has spent many years studying and writing about family stress. In particular, she's helped to bring about the subject of ambiguous loss into the forefront of social emotional health and well-being. Ambiguous loss is any loss that is unclear and therefore has no closure. Boss describes it as a problem that comes from a situation, not from your inner self. The concern is loss without closure denies the family or an individual of social acknowledgement or rituals such as funeral or other normal means of coping as described in the Kubler-Ross model. Families and individuals struggle to heal and move forward with their lives when closure or moving forward feels quite uncertain. Ambiguous loss related to the pandemic include a loss of normalcy, however you defined it before; a loss of human contact; a loss of connection to family and friends beyond a screen; a loss of jobs; a loss of routine and schedules; loss of foods that are norms of comfort; a loss of a sense of safety that one may not have realized that they have. Dr. Kathleen Burns Yeager, who is a counselor with the MSU Employee Assistance Program, shared her thoughts when asked about loss during the COVID-19 outbreak. She notes that some of the losses we are all facing have to do with the interruptions to the family life cycle. This includes the cultural rituals we share during births, deaths, birthdays, holidays, school, vacations, graduations, baby showers, weddings, sports. Many parents are experiencing a collision of roles which involves a loss of freedom. Some have had to adjust to working from home, homeschooling, and continuing to provide all the home maintenance that comes with raising a healthy family, physically, socially, and emotionally. People are experiencing losses and feelings of uncertainty related to the usual structures of their lives that have been shifted or pulled away indefinitely. She recognizes that part of the problem is that there's no finite ending to all of this. This type of loss can be a source of constant stress, whereby realizing there will be a new normal, but not knowing what it will be like or when it will happen. And it makes it harder for people to plan anything or to reassure themselves that things will be okay. It's important for people to ground themselves in their own resilience and to remember to accept what is lost, but also look forward to what is possible. With all that stress that can build up, it's important to focus on ways to build your own resilience to stress. Develop resiliency and try to find comfort in the ambiguity. Remind yourself that it is what it is and you will get through this. Use mindfulness to accept your feelings as they are when they come up. Find a mastery of the controllable and everyday life, like cleaning house, cooking, and laundry. Practice acceptance and letting go, being comfortable with the imperfection of life. No one expects you to be a perfect parent, spouse, significant other, teen. Include daily self-care, rest, recreation, accept help, and find humor in life situations. Share stories, remember the past, share and enjoy pleasant memories, and concentrate on making new memories. Create new ways to celebrate new ways to celebrate, such as host a virtual baby shower, birthday, weddings, organize celebratory car parades, plan regular virtual family get-togethers. We have a quiz, and I'm not sure if you're able to get to it in the chat, but I can try to post it. This is one if you took the Stress Less with Mindfulness class. It is one that you can take online. That link takes you straight to the Qualtrics survey, and there are maybe 20 statements that you answer as to how vulnerable or resilient you are to stress, because we always think of stress as weighing us down, but none of us really realize, or sometimes we don't realize, how resilient we are to the stress. So some of the things that are listed on this handout are like, I eat at least one hot balanced meal a day. If you can check that you almost always do that, that's one of those items that makes you more resilient to stress. Or getting 7 to 8 hours of sleep at least 4 nights a week. Giving and receiving affection regularly. Exercising to the point of perspiration at least twice a week. Getting strength from your religious or spiritual beliefs. Regularly attending social activities, only now it would just be virtual. Having a network of friends and acquaintances. Having at least one friend you can confide in about personal matters. Doing something fun at least once a week. And taking quiet time for yourself during the day. These are all behaviors to concentrate on doing more of, especially when you're feeling more stressed. So when you do get to take that quiz, you really want it to have the lowest score possible. So if you get a score of 0 to 10, it indicates that you have excellent resistance to the vulnerability of stress, and so on. You really want to have a score of under 49, 49 and under. Most of us have some vulnerability to stress, but like I said, increasing those behaviors I mentioned before will be things that will help you lower your score. It's important to recognize how health has been impacted by COVID-19 for healthcare providers, patients, and caregivers, and find ways that you can work to assure optimum health for you and those that you may care for. In an effort to keep patients and healthcare providers safe during COVID-19, massive public health messages are by now familiar to most, such as wearing personal protective equipment, social distancing, hand washing, mask, increased testing. In a New England Journal of Medicine article, Dr. Lisa Rosenbaum describes how medical professions have had to quickly adapt to caring for COVID-19 patients while also providing continuity of care for non-COVID-19 patients. Although there has been a pause on elective procedures such as knee injuries, hernia repairs, other delays may mean life or death. Susan Carr posted an article in Improved DX newsletter in July 2020 that reported the following impacts of COVID-19 related to delayed or misdiagnosis. Visits to the emergency department had decreased as much as 50% in some facilities. People have avoided emergency department visits because they're afraid of catching COVID-19. A no visitor hospital policy has added to the fears of the pandemic, and they're worried about not overwhelming the already burdened healthcare system. Susan Carr also noted the following. Emergency medical services reported an all-time high number of cardiac arrests in the field. Emergency medical services also reported a four-fold increase in the number of on-scene death pronouncements in April 2020. Care providers put a hold on non-emergency appointments. Current environment is a critical reminder to maintain your physical health by increasing your knowledge of risk and preventive measures, and maintaining chronic conditions and staying up to date with your medical care needs from your primary care provider. And now I'm going to turn it over to Georgina to finish out the workshop.
Thank you, Holly. So if you're wondering, what does all this mean to you, and how can you assure optimal physical health even during a pandemic, we do suggest implementing some of these following strategies. Increasing your knowledge about symptoms of heart attack, stroke, and other life-threatening conditions. Do not ignore symptoms and seek medical help as soon as possible. Call 911 or go to the nearest emergency department. And to encourage your family, friends, and neighbors by giving them the same advice to seek medical care if they have any symptoms.
Georgina, oh yeah.
I didn't realize, sorry. I didn't realize I could change the slides. So, okay, here we go. In addition, You should also keep up with your preventive medical care, such as routine physicals, lab works, immunizations, and try to assist others in your care or that you care about so that they can keep up with their routines and their preventative health care. These strategies are especially important if you or someone that you are caring for has a chronic condition. For example, if you have a chronic condition such as diabetes, high blood pressure, or COPD, you know that it is critical to keep in touch with your healthcare provider on a regular basis. Some chronic conditions require regular medication monitoring and adjustments as needed. In addition, you can also educate yourself on the options for virtual healthcare in order to support your physical health. In an article posted in Telemedicine and eHealth, the case is stated for increasing and improving virtual visits. During COVID-19, virtual visits keep vulnerable patients safe, especially those that are in high-risk category, such as older adults and patients with chronic neurological conditions. These authors suggest that combining virtual visits with wearable diagnostic devices can help support healthcare providers, patients, and their caregivers. Wearable devices can track data for patients with chronic conditions and upload information to medical care providers to be used with telehealth visits. Things that are already easily monitored include physical activity, blood pressure, electrocardiogram data, and glucose monitoring. Virtual visits may also work to reduce medical costs and reduce the burden on those patients' caregivers who are responsible for transporting loved ones to appointments. Considering many caregivers fall into a vulnerable population, this is an added benefit in order to help keep them safe. So what types of care can one get using telehealth? You might be surprised by the variety of care you can get through telehealth. Your doctor will decide whether telehealth is appropriate for your health needs. If you need care, especially during COVID-19, it's worth checking to see what your telehealth options are. For example, you may be able to get general health care, such as wellness visits, prescriptions for medicine, dermatology, eye exams, nutrition counseling, mental health counseling, urgent care conditions such as sinusitis, back pain, urinary tract infections, and some common rashes. With a chronic health condition, it is very important to have a plan in place for emergencies. A few important items include having enough water, food, and medical supplies that can last you up to 2 weeks. Along with your medical supplies, you will want to have at least a 2-week supply of all of your prescription medications available. Keep copies of your insurance cards, photo ID, contact information for family members, doctors, pharmacies, and caregivers in a waterproof bag. Also, take photos of each of these documents for additional backup. Make sure you have a family member or a friend that will check on you daily or at least weekly. Always keep your phone fully charged and with you, even if you are just going out to get the mail or going to the bathroom. Creating a care plan will provide information on all of your health conditions, current treatments that's being delivered, your medications, physicians, and contact information all in one place. This is very useful for doctor's appointments, caregivers, and any emergencies that may arise. During uncertain times, a journal can also provide an avenue to express your thoughts, whether those thoughts are positive or negative, and as a way to help you relieve any stress and anxiety. These are some resources for emergency preparedness, and they will be included if you do receive the handouts afterwards. There are also many self-care management classes. So if you are someone that is dealing with a chronic condition, or perhaps you are a caregiver of someone who has a chronic condition, you already realize the importance of knowing about risks, prevention, and treatment of those conditions, which includes maintaining good communication with your healthcare providers. In addition, maintaining physical health may include increasing your circle of support. One way to do this is by taking part in group classes to learn to manage your health and the health of someone that you care for. Michigan State University Extension has classes that can help support you, such as personal action towards health. We also have falls prevention classes, powerful tools for caregivers, stress less with mindfulness, and relax alternatives to anger. These classes offer a way to increase your knowledge with research-based information with content experts in a small group format. And you may visit our website to obtain more information on these classes. The personal action towards health, which we refer to them as PATH classes, these are evidence-based programs designed to support individuals living with chronic conditions such as diabetes, heart disease, asthma, arthritis, and chronic pain. Participants learn important skills to better equip themselves to face those daily challenges of living with chronic conditions. I'm actually going to take you through one of the activities that we do in one of the pain path classes, which is the path for chronic conditions. And this is using a guided imagery exercise. This is specifically lemon imagery. So if you could just follow along with me for the next couple of minutes, I'd like for you to take a deep breath. And if you can, allow your eyes to close. I would like you to imagine now that you are standing in your kitchen or the kitchen of someone you know, and in front of you is a cutting board. Next to the cutting board is a good sharp knife. Now take a few moments to imagine the kitchen, the color of the countertops, the appliances, the cupboards. Notice if there are any windows, and also notice any smells or sounds. The running of a dishwasher or the sounds of the refrigerator. Could be the sound of a clock on the wall. Just take some time to notice everything using all of your senses. Asking yourself, what are you seeing? What do you hear? What do you smell? And how you feel being there in the kitchen. Now imagine that on the cutting board sits a plump, fresh, juicy lemon. In your mind, hold the lemon in one hand, feeling its weight and textures. Then place it back on the board and carefully cut it in half with the knife. Feel the resistance to the knife and how it gives way as that lemon splits. And notice the pale yellow of the pulp, the whiteness of the inner peel, and see whether you have cut through a seed or two. Carefully cut one of the halves in two. And notice where a drop or two of juice has purled on the surface of one of the quarters. Now imagine yourself lifting this lemon wedge up to your mouth, smelling the sharp, fresh scent, and biting into that sour, juicy pulp. This guided imagery is one way to show us the power of our brain. Some of you may have felt or thought about what it really would taste if you bit into this lemon, the sourness. You could almost even taste it or imagine the juice just dripping down. So someone did say, love it, it made me hungry. Yes, it gets your brain thinking about food, even though it's a lemon, which we normally would not eat by itself. But this is one of the things that we do in the personal path class, because when we're talking about dealing with chronic pain, some things that we can do are just all within our thoughts, and how we can try to put our thoughts and our focus on something other than what we are feeling at that moment, which is, chances are, it's going to be pain related. Another class that we have that is available is Tai Chi. So Tai Chi for arthritis and fall prevention is an evidence-based program that combines gentle movement with breathing. It has been shown to improve balance, strength, vitality, and relaxation. Studies show that Tai Chi can reduce falls by nearly 70%. Participants learn warm-up and cool-down exercises, 1 or 2 movements per lesson. They also learn breathing techniques and principles related to improving both physical and mental balance. Powerful Tools for Caregivers is another evidence-based program that is designed to equip family caregivers with a range of self-care tools that include the following: different ways to reduce personal stress, how to communicate effectively with family members and healthcare providers, how to hold family meetings, being able to deal with difficult feelings, and also making those tough caregiving decisions. This program is designed to help the caregiver take care of themselves. We also have our Stress Less with Mindfulness, and this teaches and encourages the use of mindfulness self-care skills to help one feel better and enjoy life more. The program covers mindful breathing, mindful movements, mindful eating, and the physical processes that are occurring in the brain and body, and also mindful laughter. We also have our Relax Alternatives to Anger. How we handle anger affects our emotional as well as our physical health and can carry over to our relationships with others. Relaxed alternatives to anger helps people understand and manage anger and stress and develop communication skills that are needed for healthy relationships. All of the programs that I have just talked to you about are currently available online and they are free. And you can go again to our website if you're interested in finding out more about any of those programs. So I don't know if Holly, you have anything that you would like to add?
If anybody would like to have information, I will send it to Katie to post on their website.
All right. I know we're done early. I don't know, Holly, if you wanted to walk them through a mindful breathing exercise or a brief meditation.
Yeah, either I can do it or you can do it. Would you like me to do it?
Yes, I don't have my, that's why I don't have my script up.
Okay, I'll do it.
Okay, thanks.
Okay. All right, so we're going to do a brief mindful breathing activity just to close out the workshop and get you ready for the rest of the day. If you could, or if you feel comfortable, you can close your eyes or you can just find a spot to gaze at. Get into a comfortable position, whether you're sitting or standing. Rest your arms, feel your feet on the floor. Take a couple of deep breaths in and out, in and out. Just settle into your own pattern of breathing. And as you're breathing, feel the air go in through your nose, down to your lungs. Feel it come back out again. Notice how you just settle into the natural rhythm of your own breath. And as your mind wanders, which it will do, just bring it back to noticing how it feels to breathe. Breathing in and breathing out. Now just take a couple of big deep breaths in, blow them out, another one in, and blow it out. And when you're ready, go ahead and open your eyes and come back into the space that you're in.
Thank you, ladies, for joining us today for this. We appreciate your class. Thank you for everyone joining us today. And if anyone has any suggestions for lunch and learns they would like to see, you can always email us at mwrbattlecreek@dla.mil. Thank you so much and have a wonderful weekend.
You can also share our emails, Georgina's and mine, in case anyone has any questions.
Okay. Great. Thank you.